So what is gastric bypass surgery? Gastric bypass, as the name implies, is bypassing the stomach. It's plain and simple. And it is one of the oldest known surgeries for morbid obesity. And it is also the gold standard of the world. So it is not something that I say it is the best surgery or someone else says. It is the gold standard recognized by all the national and the international forums and national and international bodies. Now here I would like to stress something more about the gastric bypass. Now what exactly is happening in a gastric bypass? Gastric bypass is a combination of restrictive and a malabsorptive procedure. And over a period of time, the malabsorption actually becomes less and less. Why? Because the intestines get adapted towards the malabsorption. So what do we actually do? We create a small pouch or a proximal pouch of the stomach. Thereby, we make a 20 to 50 cc of a small stomach, or a new stomach is formed in the upper part of the existing stomach. Then we connect this stomach to the upper part of the intestine by using your own intestine and create an alternative pathway for the food which comes to this reservoir or the proximal pouch to the upper part of the intestine. Thereby, we are trying to bypass this food which mixes with the acid, the bile and the pancreatic juice to go to the upper part of the intestine without mixing. So, in other words, we are bypassing the food from the stomach and the duodenum and the upper part of the jejunum so that the food goes directly. Therefore, it is called a gastric bypass. You would think, so if my pouch is about 20 to 50 cc, I can hardly eat. So basically the weight loss happens because I am unable to eat. Largely yes, but partly no. Why do I say that? The reason is the intestines are also metabolically active. That means they also secrete hormones which are very important for some part of the metabolism that is going to happen. When the food which is not mixed with the acid, the bile and the pancreatic juice comes to the upper part of the jejunum, certain hormones are being released by this part of the intestines, like peptide YY, GLP-1, oxytocin, and so forth. These hormones are very active hormones which play the most crucial role in resolving the comorbidities like diabetes, like NASH, like hypertension, which are related to the obesity. How do they act? These hormones act on your pancreas at a cellular level. At the cellular level, thereby increasing the production of the insulin, decreasing insulin resistance, ending on the end organ, and also working like insulin, like insulinomimetics. These also work on your kidneys, thereby lowering the blood pressure. They act on your liver, changing the metabolism of glucose, decreasing the fat, and they also work on your peripheral fat, the intra-abdominal fat, the fat inside your body, around your heart, around your kidneys, which is the bad fat, as I would say. So they alter all the fat, they alter all the lipid metabolism inside. They increase your resting basal metabolic rate. So you burn more. So it's not only eating less, but these metabolic factors, the release of these hormones and the interplay between the hormones and the other systems of the body, that this metabolic surgery works. So to recapitulate, yes, you eat less, but the main action is not because of eating less, but because of the metabolic factors which are released and the hormones which are released from the intestine. Because over a period of time, the pouch that we've created will increase in size. So you should be able to eat more and more once you go past a few months or several months and years. So it should be failing there, and it doesn't fail. So it is not only the restrictive part, but also the malabsorptive or the metabolic or the hormonal part, which is a more important part to make this surgery successful.